It's 7:41 for families dealing with autism. A lot of them will try anything to treat it. One treatment that's growing in popularity is what's called hyperbaric oxygen therapy. Autistic children climb inside the chamber and breathe in oxygen at a level higher than atmospheric pressure. Now, this chamber, may look intimidating, which is why they're designed so parents can actually climb inside with their children to keep them calm. Studies show the therapy helps improve functioning, language, and social interaction, but there's some controversy as well. Dr. Bhide is a physician with St. Augustine Adult and Pediatric Medicine, here to explain the benefits and the criticisms. Good morning to you, Dr. Bhide.
Thank you for
being here. We've done a lot of autism stories, and a lot more parents are talking about this hyperbaric oxygen type therapy. Has it been shown to work?
Well, what's really exciting is that recently a study was released which shows in 29 children that 80% of those children benefited in their autism symptoms, exactly what you described. Eye contact, social interaction, speech and language development, irritability, and just overall functioning.
Let's put this into perspective about this type of oxygen therapy. Room air is 21% oxygen at a pressure of 1 atmosphere. In the chamber, oxygen is the level of oxygen is 24% at 1.3 atmosphere pressure. Now, how exactly does this increase in atmospheric pressure and oxygen help, according to the study?
Well, what we theorize is that the increased pressure and the oxygen somehow heals any damage that may be in the brain, increases oxygen for functioning, their blood flow, possibly improves the immune system. Truthfully, we don't know. These are all theories, and clearly we see that children with autism do improve with this treatment, as do other children, for example, with cerebral palsy, patients with stroke, wound healing, other kinds of things where there's a lack of oxygen in their brain.
Hyperbaric chambers have been around for a long time to treat a number of maladies. Has it been approved by the FDA for autism?
It has not been approved for the treatment of autism. It's been approved for the treatment of altitude sickness, for the bends, more common things that we think of, wound healing. But it is what we call off-label use for the treatment of autism.
Are there any dangers to subjecting a child with autism to hyperbaric chambers?
Well, you have to remember, this is a medical treatment. The Food and Drug Administration does consider oxygen therapy a medication, so you have to take it seriously. Fortunately, in this study, it was shown that this treatment is actually very safe. There were very few side effects. My only caution to parents would be careful. In this study, patients received an hour of treatment, 40 total treatments. There have been case reports where children have received more treatments twice a day or more often without a period of time in between treatments for the brain to recover. And those children actually had regression of their autistic symptoms. So you want to be very careful and have this treatment under the supervision of a physician who's used to doing this.
And then we saw that chamber with the father sitting inside with his son. Is it safe for a parent who has no maladies to be inside of it as well?
Yes, there's no reports of parents other than claustrophobia, I guess, is the only thing. But in general, it's very safe, and I think it helps the child to have the parent in the chamber with them.
I've got a number of questions for you. We're running out of time. Does insurance cover the cost of this treatment?
No, unfortunately, it does not. Because the treatment is not approved by the Food and Drug Administration, it is usually not covered by insurance. So it's unfortunately something that the parents would have to fund themselves.
Okay, and it's important to note as well that some people have criticized this particular study because 6 out of the 8 authors may benefit financially as a result of the hyperbaric chamber treatment. So keep that in mind as well. Well, thank you very much, because I know a lot of parents with autism, or their children with autism, are watching, and it's good to know the potential pitfalls of this as well. Thank you.
Thank you so much for having me.
Appreciate you being here this morning.